Hello and welcome to another wonderful episode of hashtag Ask the Home Care Expert. I am your residential expert, David Posner. Here with me, my lovely guest is Rosa. She's with Vitas Healthcare. I've tagged a few groups today and spoke with a few groups last night. Because of our very special guest, we've had a lot of questions this past week regarding hospice, how it works. Though instead of me answering some questions, I figure I'd bring in the expert here to help us all out. So first off, thank you everyone for joining us today. Really appreciate it. If you have questions, we will be monitoring them. So go ahead and write them in the comments section, and we'll make sure that we get to them. Also, if you're watching this on YouTube, please subscribe to our page, and we'll also be able to follow questions throughout the week on YouTube and some of the other channels this is going to be promoted on. So thank you everyone for joining, but most importantly, thank you, Rosa.
Thank you for having me.
Absolutely.
Pleasure.
So why don't you tell us a little bit about yourself, how you got into hospice care, and kind of get us going for the day.
I kind of fell into it by accident. I started off as a journalist many moons ago. I got into it in the early 2000s when I lived in Florida. I worked for 2 hospice organizations there. Most importantly, I fell in love with it when I watched my mother go through it almost 10 years ago now. She, unfortunately, we lost her to pancreatic cancer, but a wonderful hospice organization came in, took care of her, and just fell in love with the philosophy and just wanted to dedicate my life to giving back to others.
Good. And I've worked with Rosa, I know, several years now. We're pretty close friends. That's why I had her on here today. And, but the big thing about hospice, the number one question I always get for hospice is, how does it work? Like, how do I know if I'm ready for hospice? Do I, as the son, call for my dad? Does a doctor have to call? Do I have to, be in a hospital, and the hospital, the nurse decides? How does it work? How do I know if I'm ready or if my mom or dad are ready?
One is really never ready, but it is a part of life. As you grow older, we sometimes succumb to chronic illnesses. There's several ways that you can proceed in going to hospice. You as the patient or you as the individual, if you know that you have a chronic illness and so forth, you can talk to your family, you can talk to your primary physician. First, you do have to talk to your primary physician because it is the primary physician who has to recommend hospice services.
So kind of like a doctor's script.
A doctor's script, okay. Exactly. So it is him or her that will have to write that script and present it to us so we can go and evaluate. Also, if a family member, the caregivers are the main overseers who can dictate whether a loved one is getting to that stage where they're losing weight, they're suffering from dementia, they're suffering from any kind of illnesses where they just see that they're not up to par as they were a couple years ago. So they might start having that discussion with their loved one, and also their primary care physician as well, or another specialist. So once we have that order in place, obviously they'll contact us, and then we will start procedures of having that discussion and contact the family members or the individual themselves and continue in that route.
Okay, all right. So, I did get a few questions this week. So let's kind of hit on the first one. So this is from Karen in Washington, D.C. She asks, is hospice covered by Medicaid and Medicare? And should I or can I pay privately if I really want the best nurse? If I've heard this company's really good or this nurse is really good, can I pay privately for it? How does payment work?
Our organization is unique in that we don't turn anybody away regardless of insurance.
Okay.
We are medically funded, so yes, Medicare. Medicare is a benefit that we pay into from day one, from when we start working. So if you do have Medicare, of course, we will bill to Medicare.
Okay.
If you have Medicaid as well, and any private insurance. However, the most important thing to remember with Vitas Healthcare is we do not turn anybody away, regardless of insurance. We are able to accept, anybody. We don't turn anybody away. Our focus is to get to that yes. If we can take your loved one who has a chronic illness and has been given a terminal illness of 6 months or less, and they are acceptable to hospice, we will care for that loved one.
Okay, so Medicaid, Medicare, insurance, you take it all.
we take it out regardless of insurance. That's the most important thing. Even if you don't have insurance, we will take care of you.
Now, is that common with all hospice companies, or do some hospice companies work only with certain insurances, kind of like a doctor's office?
I like to say all hospices will have that same philosophy as we do. I can't speak for all of hospices. There are some hospices that maybe have a cap on how many patients that don't have insurance that they can take.
Okay.
So I can talk for Vitas only in this session. So I can just say that with Vitas, we take everybody.
Great. Okay, that's good to know. All right, so our next question is from Tracy in Silver Spring. My mom is in a nursing home. She's in a wheelchair bound and needs a lift to transfer. She's incontinent, eats small amounts, lost a lot of weight, very faint voice, fear. Her biggest question is, how does a doctor know when to start hospice? Is there a protocol? Is there signs or symptoms? Is there a checklist for that the doctor? So I might not know anything about hospice, but will a doctor see that my mom's losing weight? Check. My mom's not eating a lot? Check. My mom is XYZ? Check. Is there kind of a checklist that doctors go through? And if so, what are some of those items?
Obviously, most doctors, they follow their patients over the years, and hopefully, sometimes patient loved ones move quite often, so they might not know them as well, but in most cases they do. So they're going to know if a patient's starting to decline from history and physicals, blood work, and so forth. With this certain loved one, it looks like she has lost weight and so forth. So the doctor is going to look at some of those factors, and it's going to have to start having that discussion with them. If he can also call us. Myself as a liaison can have that discussion with a family member and talk to them about the benefits of hospice and so forth. If they would like to have more information, we can also have, once the doctor writes the script, we can have an admissions nurse come out and do an assessment. The admissions nurses are trained to look for certain factors. We'll review the history and physical and blood work provided by the doctor, review it with our medical director, and upon their assessments as well, then we'll proceed in whether they're hospice appropriate and go forth in admitting the patient.
Walk me through an assessment. I know it's done by an RN.
It is.
So kind of give me an idea of what I should expect when the nurse comes in for that assessment. Are there things I need to have prepared? I know some families have a DNR, it's a do not resuscitate. Or does the nurse kind of know everything and I just sit back and answer questions? And how long does the assessment take?
Our admissions department is very diligent in about getting the history and physical and all the chart per se as much as they can prior to the nurse going out there.
That's from the doctor's office and the hospital or something.
And so forth. So they do their homework prior to meeting with the loved one and the family members. So they're going to know walking into the room, home, and so forth, what the patient is suffering, if there's been a decline, and so forth. So right then and there, they have a pretty clear understanding of what's going on with your loved one. From that moment on, then there's assessment forms that we have in place to what the nurse herself is trained to look for to see if they're hospice appropriate. Obviously, I'm not a nurse, so I can't tell you exactly what they're looking for, but believe me, our hospice nurses are trained to look for those signs and symptoms, and along with the medical records we received and our medical director that we have on board. We actually have a medical director, an associate medical director, and 2 nurse practitioners. One of our greatest things that we have now is we have a consulting cardiologist on staff, that if we have cardiology patients and so forth, our medical directors can also consult with the cardiologist.
That's great. And your staff also has, that's a little bit different, is a chaplain and some religious as well, right? Is that to help support the family?
So we're blessed in that we cover all of Northern Virginia. In Northern Virginia, we have 5
teams.
teams.
Vitas is nationwide.
Yes, we are.
Okay.
Thank you for correcting
I was
me.
about to say, give yourself credit for...
We are actually the largest hospice in the United States.
Congratulations.
We've been around. Thank you. In Northern Virginia, we cover anywhere from the Warrenton, Fauquier County to Arlington to, oh goodness, all over. In that region, we have 5 teams. On that 5 teams, we have a group of social workers, chaplains, home health aides, a group of wonderful nurses, team managers that oversee that, and then our physicians that oversee and go over the care plans weekly on our interdisciplinary team meetings. So yes, we do have we have, to answer your question, we have chaplains that cover all faiths, and a wonderful group of social workers who are there to help the bereavement process as well. And we don't stop with the families once a patient or loved one declines and so forth. We're with them through all the steps, including up to 13 months afterwards.
Wow.
So we are there.
You really
100%.
stay with the family.
We do. That is our
That's
main
great.
goal.
That's great. We got another question from, let's see, it's Tracy and Stacy in Hope, Mississippi. Well, this is a good one. So, Dad has 2 other sons. How do I talk to them about making the decision to putting Dad in hospice? How much do they know? If I am POA, or if I'm personal responsible for my dad's care, I'm personally responsible for the finances, what advice do you have for family members that got to talk to others that are not local or not really involved, and also really don't have that much of a decision process?
It's a difficult situation, obviously, if everyone's not on board. We have trained experts, our social workers and so forth, to kind of talk to them as well. Our mission staff is wonderful. I have talked to many family members myself as a community liaison. First of all, we'd like to talk to the loved one themselves first to see if they're in clear mind to make those decisions on themselves, because ultimately it's their decision as well. They have to be acceptable of hospice. In the event that they cannot make that decision themselves, we do have to rely on the member that is the power of attorney, because they are the ones ultimately who are going to be signing the consent forms and so forth. But our main goal is to try to get all the family members on board and involved, because it impacts everybody, not just their loved one, but the entire family. So that is our main goal, to reach out to the entire family and make them sure they're comfortable and so forth. But logistically, it does come down to the power of attorney.
Right. Now, will sometimes you talk to the other family members? Let's say, I'm intimidated by my other brothers and sisters. Will you make the call sometimes for a family member, or do you kind of you only talk to the person responsible?
We have dedicated staff members to do that. My admissions manager has talked to many of the family members. If we need to call one of the team managers, the social workers, one of the clinicians to do it. We're proud in the fact that we all come together to work together to do this, to talk to the family members. So no, I don't just talk to anybody. I'll be more than happy to, but we come together as a group to do them, to make those decisions and to make those phone calls.
That's great. One of the other questions that I get asked from time to time is how much time is hospice actually in there? So, are you there 24 hours for the next 6 months, or are you in there? I've seen it, sometimes a little bit less than 24 hours. So how much? And then from each of the different, is it just is it an LPN? Is it an RN, social worker? Kind of walk me through who's in the room and how often they're in the room.
So that's an excellent question. So no, we are not in there 24 hours a day, but we are in there almost every single day. You're going to see a member of our team almost on a daily basis, whether it's the nurse, the home health aide, the chaplain, or social worker. We have such a large team that you will feel our presence. We do, once your loved one comes on board, the nurse and the entire team actually comes up with a care plan.
Okay.
That care plan will signify how much the nurse will come, whether it's 2 to 3 times a week, the home health aide 2 to 3 times a week, and so forth. That care plan gets adjusted depending on your loved one's needs. And obviously the medical director oversees that as well. In the event there's a crisis in the fact that the patient becomes agitated or shortness of breath, and it becomes what we call a crisis mode, we implement our intensive comfort care level.
Okay.
Our goal is to keep your loved one at home.
Right.
So what we do is, instead of sending the loved one to the hospital in extreme emergencies, we like to put the hospital in place at home.
Okay.
So we'll staff your loved one with a home health aide in the day and an LPN at night. It's our highest level of care. And the case that'll be when a loved one is on intensive comfort care, it is the first visit of the day for the case manager. She will assess to see how everything's going. She'll talk about it with the medical director and then assess if the loved one needs to be on that service for another 24 hours. That is the only time really that you'll see maybe our staff there 24 hours a day, but it's a short-term period to make sure that the loved one gets back onto routine home care. Now, we do, although you might not see us there 24 hours a day, you will always be able to contact us 24 hours a day because we have an after-hours number called our telecare.
Okay.
And God forbid something were to happen after hours.
Which sometimes it does.
Which sometimes it does.
Not everything always happens between 9 and 5.
You can call our 1-800 number
Okay.
and you will get a live clinician. This is a great asset. You don't get an after-hours program saying, oh, we'll call you back in an hour and so forth. You will get a live nurse on the other line. She will direct you. She has access to the medical records. So she'll talk to you through what's going on and so forth. If she can't help you, not that she cannot help you, but if a nurse has to come out to assess the situation, we have our on-call staff who will then be routed to come to visit you.
Okay. And we actually partner pretty well together.
Mm-hmm.
So, as she was talking, a lot of times when it's not in that intense situation, we actually partner with home care. So a lot of times home care can actually be that substitute. So as that nurse is in there, 2, 4, whatever it may be, you can actually hire someone from our team from HomeCare.com to be in there 24 hours or live in or whatever it might be to make sure that your loved one is covered. So, one of the great things of bringing Rosa and Vitas in here is that we work together quite a lot. So home care is also another person that might tell you or a family member or another that as far as what is going on, and that you might recommend hospice. Some of our caregivers may recommend hospice. Also, when hospice is in there, a lot of our caregivers might be able to speak directly with the hospice nurse and say, just want to let you know, here's a change of condition, here's what we've noticed throughout the day. And so a lot of times, home care will partner directly with hospice to make sure it's a good part.
Absolutely.
Yeah.
And we do rely a lot on your organization and so forth when extra care is needed, and we do, our social workers and our chaplains, and I like to call them our frontline staff because they're the ones out there in the field. When they see that extra care is needed and so forth, they do not hesitate to call me and let me know, like, hey, Rose, I really think this family needs extra help. Who can I call to have that extra care come in? And then that's when I'll reach out to you, David, and so forth, to get that extra care for our loved ones.
Yeah. So to start to wrap it up, last question today is from Tammy in Waldorf, Maryland. I have an 85-year-old grandmother back in the ER for the second time in 2 weeks. Last time doctor said she is at the end stages of dementia and suggested hospice. Currently we have home help and a caregiver that comes out 2 to 3 times a week. Just looking for suggestions on when is it time to give up home care and call in hospice. She kind of gives a little bit more detailed information I don't want to share here. She's been a little bit dehydrated, non-vocal, but we kind of just touched on this as far as home care and hospice kind of working together. So I actually, if you don't mind, Rose, I'll answer this one.
Sure.
And just say you don't really have to give up home care. You can actually call in hospice. Correct me if I'm wrong. Your evaluations, your assessments are free.
Oh,
right?
absolutely.
Yeah, so you actually have to get a doctor's prescription to get hospice in there. So if you think that you might need it, talk to your doctor, be able to get it. The assessments are free. No charge for an RN nurse to come out and do a hospice assessment and check it out. Or again, meeting with your doctor. But as we previously mentioned, home care actually works well with hospice. So as hospice is in there, a couple hours a day or every other day, home care can actually be that ongoing person that's being able to kind of check in with the hospice team.
Absolutely.
Anything you want to kind of add to that?
Well, in this situation, it looks like this loved one has been readmitted to the hospital a couple times. So, the hospitals keep track of that. And right now, reducing readmissions rate is something that they're looking really into these days. And so, seeing this, they're going to, start talking to the family about hospice care, especially if she is declining, so they can keep that loved one in the home. So that's when they are going to write that order. They're going to start calling our organizations and so forth to have that discussion. So this is a really good example.
Yeah, no, it absolutely is. And like I said earlier, we love working with Rosa and her team, Vitas. But not all hospice companies are the same. There's a lot of different types out there. Why don't you tell us about Vitas and kind of what makes them different?
Well, we already kind of touched upon that a little bit, David, but I'll expand it. We are the largest hospice in the organization. Vitas stands for life. We try to add the quality of life at the end of life when it's the most needed. We have a wonderful staff here in Northern Virginia and nationwide. We have our intensive comfort care level where we bring the hospital to the home when the loved one needs it, when it's in crisis mode. We have our wonderful telecare system. We have a cardiac care program, which we now have a consulting cardiologist on board. We have a nurse practitioner who has a cardiac background. We work well with other VITAS programs in our other states when family members would still want to travel. Loved ones still want to travel. So we work with other hospices in other states to allow that loved one to travel. We have one of our clients who still goes to the Bahamas every year. Well, when he can.
Yeah.
And so forth. So that makes us a little bit more distinguished above all. And we just have a wonderful staff. I couldn't be prouder of this organization. They're my second family.
Awesome. And how do they get in contact? So let's say they do have questions. Obviously, if you have questions or comments, please leave them here. We'll be checking them throughout the week. But if they wanted to reach out to you, Rosa, what is the best way for someone to reach out and learn a little bit more about Vitas?
They can definitely call our office at 703-270-4300. They can ask for me, Rosa Concepcion, or ask for our admissions department. If it is after hours, they can call our referral line at 800-93-VITAS. That's VITAS. Again, that's 800-93-VITAS, VITAS. And again, I'm always here available for you and for anybody who needs our services.
I know one of the other nice things is they do have frequently asked questions on their website. So any questions that weren't answered today, you can always go to, I believe it's Vitas.com.
Yes, it is.
Vitas.com under frequently asked questions and be able to ask some of the other questions that might not have been asked today. Or again, myself and Rose will be checking the comment section throughout the week. If you have further questions, be happy to answer it. But is there anything else you want to leave with?
No, I just appreciate you having us. Again, if there's anything myself or my organization can do, please don't hesitate to call. And I wish everyone a happy holiday season.
Absolutely. So thank you all for tuning in. Next week we'll have Noah from Mobile Dental. And so he's going to be talking about the importance not only of dental care for seniors, but someone with Alzheimer's, the importance of having dental care. Someone on hospice, the importance of having dental care, and his mobile that's able to kind of go into the family's home. So we'll have some great insights regarding that. Again, if you have any questions or if there's any particular person like Rosa you'd like me to bring in as a guest to have your questions answered, please let me know. We'll also, again, if you're not catching us live or missed us, please leave a comment on our YouTube or Facebook page. Otherwise, thank you everyone for joining us today. Have a wonderful weekend. Goodbye.